Yes, good afternoon, Madam President. I rise for just a few comments on the bill in front of us today. First, I would like to thank the chairs of and the ranking on appropriations. I sit on appropriations and I understand how many meetings it is, how many subcommittee meetings, and after 7 years of being on that committee and meetings, I can't even count the number of public hearings and the length of time. So my hat is off to Senator Austin and Representative Walker, who really lead that group, and I can't imagine, the time and the dedication to this budget, and also to Representative Nuccio and Senator Berthel for helping as the ranking members on that committee. I just wanted to touch on a few things in this bill proposal that I find a little bit frustrating. The process of appropriations, that we sit through countless public hearings, which are really beneficial. We hear from the public, we hear the concerns or the asks, and I think the Appropriations Committee and all its members does their best to try to make the appropriate decisions for what the citizens of Connecticut are asking for and what the needs are to cover the needs. And then we come out with an appropriations budget, and then it gets meshed with other budgets that have come out. And in the end, sometimes the budget that we see as the appropriations member looks very little like it did coming out of appropriations. And I think at times that is very frustrating. And you see the different asks that have been put into the budget that don't necessarily collide with what the public is asking for. It tends to become more political at times. That being said, there are things within the budget that I wish were here, things that weren't in the budget that I wish were here, that I think are really important for our state. One of them has to do with intermodal transportation in our #1 tourist destination in Mystic, Connecticut. The bill passed. We needed a very little amount of funding to be able to produce a study that would help take cars off the road, help with congestion, and help increase our tourism numbers in the state of Connecticut as people become highly frustrated as they watch the highway back up and can find no place to park in our small community that is, again, the revenue generator for the state of Connecticut. So they get frustrated and they leave and they go to Boston or someplace else. We have calculated that nearly 400,000 people get frustrated and leave, meaning they don't stay in the state of Connecticut because there's no parking, they don't want to sit in traffic for that long, and because of our location, it's easy for a tourist to just move on to a different location. Unfortunately, that small funding was not included in this budget. Another area that I am highly frustrated with, as I know my fellow Senator Ryan Fazio is last term we passed a bill that would be the first study in the nation that has to do with the effects of social media on our adolescents. And we were getting Ryan and I spent the entire summer with the University of Connecticut developing the criteria along with the chairs of education and public health on what this should look like with the University of Connecticut. Unfortunately, it was only funded for half of the study. The second half is another $450,000 to finish the study, the first of its kind in the nation. So now we have half a study done. So we're half pregnant and we want to have the baby. And unfortunately, this funding was not included. It was included in the Republican budget, but it was not included in this budget. So now we have spent nearly $500,000 in the state of Connecticut for a study that's not finished. And that study, again, would be the first of its kind in the nation, is extremely valuable, and could provide us with ideas on policies that we could implement to help curtail what we're seeing in our adolescent youth, especially girls, where we're seeing the suicide rate skyrocket. So that is an unfortunate area of the budget that was overlooked. I also am going to touch on this. I know that Senator Austin tried diligently to have this funding added to the budget, and it has to do with the summer enrichment program that is run by the State Department of Education. Unfortunately for us that live in Eastern Connecticut, it appears that most of the larger summer enrichment programs that service multitude of towns, so up to 8 towns in Eastern Connecticut, where the demographic is very poor. They have to travel a very long way to get to a summer enrichment program, which is typically done on the school property. None of them were funded in this budget. And I know that that has to do with the State Department of Education, but if we could have increased the funding, which was not that much in the scheme of this entire budget, we could have serviced children from 8 towns, rural towns in Eastern Connecticut, and many of them with disabilities that now will be left with nothing to do this summer and no transportation for any kind of camp or enrichment to get them ready for their next year in school. And I really find that disheartening, to say the least. And when you looked at where the money was going, it was going to much wealthier parts of the state of Connecticut, including some of the districts that I represent, where Eastern Connecticut in that northern district really, really is an area of great poverty and need, which is often overlooked, and that's very clear in this budget. I wanted to talk for a moment on tourism. I want to thank the chairs for the allocation for tourism, but again, it falls short of what was requested by all the advocates. Myself and Representative Parker worked with the advocates and the industry over the last year to develop a comprehensive plan on tourism and how the state of Connecticut, in their data that have collected, is getting a return of $6 for every $1 that we spend. And unfortunately, that falls short of what the goal was. Shoreline East, I'm really happy for my fellow colleague that her train service was up to 90%. That's great news. Unfortunately for us in Eastern Connecticut, our Shoreline East funding was cut, and we have a little bit, in this budget, it's increased a little bit higher than what the governor has proposed. But many of us feel in Eastern Connecticut that the way that trains are budgeted here in the state of Connecticut, in Eastern Connecticut, you are providing us with a self-fulfilling prophecy. The less trains, the less frequency, the less ridership. So it's really difficult for us to increase our ridership when there's less and less trains available. And I can tell you, we have offered to show how many people will use the train in Eastern Connecticut on Arts Festival weekend, which is in Mystic, Connecticut, where we see about 150 to 200,000 visitors on that weekend. We've said, put extra trains on that weekend and watch how many people will go on the train and ride that train, and you will see that the use is there, but you have to have trains that are running frequently and often. So unfortunately, we are at 44% of what we should be for fully funding and trains. So we'll see next time what the ridership looks at, but it's hard to ask us to increase our ridership when you keep cutting funding for our trains. So there are some really good things in this budget also. I'm glad to see that some of the Republican ideas were included in this budget. I'm excited to see that the nonprofits received more than was originally allocated in the governor's budget, but it is woefully below what they need. The tax reductions that have been hailed in the newspaper, the largest tax decrease in Connecticut history, is exciting for the people and the citizens of the state of Connecticut, especially those who are retired. And raising the income thresholds for those who will no longer have to pay Connecticut tax is a really great move. I hear that repeatedly, as I'm sure many of you do, on our seniors that are struggling with the rise in inflation and the cost increases that they're seeing in every place, whether it be gas or food. This is a very welcomed proposal here by many. And also the income tax reduction by couples, for couples making $300,000 or less, will go a long way. Many of those couples are families with children that are also experiencing these great increase in costs, maybe perhaps trying to save to buy a house here in the state of Connecticut. I wanted to also talk about a few things. I know we have some nurses here today, but within this implementer is a bill that we worked on in public health. We worked on it with the governor's office, the Nurses Association, the unions, on how do we as the state of Connecticut make sure that our bedside nurses are having their voices be heard. We thought that was very, very important. And this bill started out very differently than where it ended up in this implementer. And what the language is in the implementer is a really great compromise that provides the nurses the voices that they need in the hospital on the staffing committee. And it also provides an opportunity to have those committees report to DPH, has an ability for DPH to look at enforcement and to make sure the nurses that are doing the job at the bedside, not just the nurses that are managing other nurses, have a say in how hospitals are staffed. And I think it will provide us with some really pertinent information. And it also could help in aid recruiting nurses to want to work by the bedside. It also touches on mandatory overtime, and I look forward to the reports and reviewing this in the next year. And I thank those that are here for sticking with us and being willing to sit at the negotiation table and come up with a compromise that works for everyone. I wanted to also talk about the new position that is added in this budget at the Agricultural Experiment Station, and I want to thank the chairs for including this position. This is a very important position for many of our farmers here in the state of Connecticut. Many of them are concerned about PFAS in their soil in which they're growing food that we hopefully can eat, the farm to table to go to our students. And we have the ability to do PFAS testing here in the state of Connecticut. We just didn't have the technician to be able to do it. So within this budget, it includes money for one technician to be able to do that testing, which will help our farmers be able to identify opportunities and land and soil that perhaps needs to be remediated or is found to be free of PFAS. I also want to speak quickly on the increase on the Medicaid payments to providers. This is critical. I know I'm excited we're going to be looking at Medicaid overall, but this increase will definitely help retain providers. We hear that every day. One of the hardest things is a Medicaid provider is getting, I believe, 40% of what Medicare pays. So you can imagine how small that amount is for services. Also, we're in public health. There are a few things in here that I think are worth mentioning. Also, to help recruit nurses into the field. We are being able now, there used to be these very stringent educational requirements to be able to teach a nursing class. And within this implementer, it includes the ability for a nurse who has worked for 10 years and has 10 years of clinical experience to be able to teach a class for other nurses, which is going to be very, very helpful to try to recruit people to teach the class. It's one of the most difficult things. A nurse will give up her salary to help teach other nurses, and many times earning much less as an adjunct professor than as a nurse. We have some newborn screening for CMV virus, which is a virus that, if detected early and intervention, can prevent a child from going deaf. So we think this is very, very important to include in our newborn screening. The last thing that I wanted to touch on is we have added pharmacists and pharmacist assistants to our Haven Health program. If you're not familiar with that, it is a program that's set up that takes $5 out of licensing fees of our healthcare providers into a pool, and our healthcare providers are able to access behavioral health or therapy in a very confidential way without having to pay. So we've added pharmacists and pharmacist assistants to Haven Health, which will start getting the $5 taken out of their license fee in 2 years. But in the interim, they are still able to use the system of Haven Health. And it is my understanding, and I could be wrong, but it was my understanding that there was an agreement that $60,000 would be set aside to cover that 2-year span until they were contributing into Haven Health. So through you, Madam President, I wanted to ask the proponent of the bill if she could tell me or direct me where I could find that in the budget, if it is in the budget.
Thank you, Senator Austin.
And I can give you the lines if that's helpful. I have it.
Sure, if you want to give me the line,
Okay.
that would be great.
It was on page 439, line 11,082, section 262 to 270.
Thank you, Senator Austin.
I'll just look that up. Hold on 1 minute.
We will stand at ease briefly.
Section 262 to 270.
Thank you very much. So I actually talked a lot about this, in particular with the Office of Fiscal Analysis, to see if we needed to put the dollars aside for this. My understanding is that the program will be able to accept them without the, it was $30,000 a year, and that the money was not necessary, at least in the first year. Through you, Madam President.
Thank you, Senator Summers.
Thank you for that answer. I just wanted to be sure. I didn't want to have people entering into the system and have the system not be able to sustain itself. It was my understanding there might have been an agreement to use some of the opioid settlement money to supplement this, but I appreciate your answer. Through you, Madam President.
Thank you, Senator Austin. Oh, I'm sorry, no more questions?
No, I'm all done with my questions. So with that being said,
thank you.
I wanted to just share that I know it's been a lot of work for many people. There are many things in this budget to be excited about. There are some things in this budget that I'm not excited about, and some things in this budget that I wish were in here, especially the Yukon study. I think that type of problem for the general public doesn't sit well, because we spent $500,000 and now we're not going to have the results from what we started. So with that being said, I think overall this is, a really great budget. It's below the spending cap. It still keeps us with a reserve, and I hope that my colleagues will join me in supporting this going forward. Thank you, Madam President.
Thank you so much, Senator Summers.